Welcome back to the topic at hand. As mentioned on top of the show from Brandon, we have a very special guest to discuss about health. As people all know, anyways, in our show, Fresh Brew as well, we always talk about how important health is. We invite a lot of doctors on our show. We talk about lungs, we talk about the heart, we talk about skins and so on and so forth. But this time around, we have a doctor who's going to be talking about some problems that Brandon, a very old man, actually has now.
Actually, I'm here in the studio. I'm here in the studio today just to testify for all these injuries that I have and how to relieve this pain and how to treat it. So I would like to say I would need to go to a mechanic.
Okay.
Well, obviously, I don't have to, right? But I feel that's my body. It's just deteriorating that way. But then again, right, it's important that we have this doctor in the house today, and our producers, they are doing a good job, especially our bosses. They know that we got leg injuries.
Now you say it.
Yeah, that's why they invited the doctor here as well. And, okay. Now to the more serious stuff. Did you know that kids are more prone to foot and ankle injuries because they're still developing musculoskeletal system, right? Musculoskeletal system. So it's very important that they don't injure themselves when they were young, because it's going to cost them when they grow older.
Exactly.
Just like me.
Yeah, and of course, like, these are the type of things that any parent out there or anyone out there actually, they need to be mindful of, because again, everything that they do matters in regards of their lifestyle, their activity, the type of shoes that they wear, all actually contributes to how you can prolong yourself in making yourself, in the best condition that you possibly can. Hence why we have a very special guest, as mentioned, in the studio. Let us introduce you Dr. RUKMANIKANTHAN SHANMUGAM, the consultant orthopedic surgeon from Prince Court Medical Center. Dr. Kanthan, thank you so much for coming down with us.
Thank you for having me here, guys.
All right.
Okay, wait. I need to pop the first question.
You want to show your foot?
Doctor, be very honest with us.
Okay, please.
Do you have ankle and foot injury?
Who wouldn't have, right?
Okay,
now you're okay, eh? No, because again, sometimes, the master himself needs to experience these kind of things to be able to relate to their patients, right? So coming back to what Brandon has actually mentioned on top of the show, these kind of, injuries, or should I say, these kind of abnormalities for teenagers, for children, is it actually quite common that happens in Malaysia specifically, Doc?
Of course, I mean, whenever you talk about teenagers, teenagers are patients, or rather, sorry, I didn't mean patients, but people who are not very aware of their health. Right? So they're not aware of what injuries that could happen, what are the possible consequences of these injuries, right? So when they play sports, they go all out, and that's when injuries happen, right? And the good thing and the bad thing about injuries in children is that the good thing is that they heal very well, right? So even if they have a fracture, they heal very well. And even if the angle of the fracture union is not so great, it actually corrects itself. So that's a good thing. The bad thing is some injuries are not reversible, especially injuries to the cartilage and all that thing. This, if it happens in a very young age, may not heal very well. And as you age, this is going to pile up.
Oh, goodness. Okay, so what about the common type of injuries here in Malaysia, especially when you hear cases like they have ankle injuries, they have foot injuries? What are the most common ones? Arthritis, young people, I don't think so, right? But what about tendon tear or whatsoever?
Okay, so when you talk about injuries, right? So injuries, the most common would be ankle sprains.
Ankle sprains?
Yep. Right. I see, like, almost on a daily basis, somebody will come with an ankle sprain. It could be as something simple as someone who stepped on a ledge, twisted their ankle, to sports, to even elderly patients who got out of bed to the toilet and then they twisted their ankle. Right? So these things can happen at the time that you least expect. And most of the time, the good thing about ankle sprain is that about 70 to 80% of these cases don't need surgery. Right? But they are prone for repeated or recurrent sprains.
Recurrent sprains.
So when you have a sprain, it's important for you to go through a proper rehabilitation so that you reduce this chance of recurrent sprains.
All right. I know the fact that we're going to be diving into this topic a bit more, but I do want to come back in regards of the sprained ankle being the most common thing that happens throughout Malaysians. Is it just as simple as, like you said, 80% of the time, you don't need surgery? So is it as simple as just putting an ice pack on it and just let it heal, putting your feet up, and that's it, forget about it, it's going to heal itself in the next 2-3 days? Or it depends?
Yeah, of course, it always depends.
Okay.
It always depends on how severe the injury is. Right? So we can't say all injuries are the same. right? Someone may have fractures, whereas others may be purely ligament injuries or just soft tissue injuries. So the management obviously changes based on how severe it is, all right? So if you have a fracture, then obviously you probably need fixation. Whereas if you have a soft tissue injury without any ligament tears, then you just rest for a few days. Once you are comfortable, then you can resume your activities. Whereas if you have a ligament tear, then you might need a bit more physiotherapy and whatnot, bracing and whatnot.
Right. So it's very common that the young ones out there, they have these issues, right? Foot and ankle injury. Now, it could be based on their lifestyle that you just mentioned. They're an athlete or whatsoever. But the young ones out there, is it because maybe back in the days when they were very active, you know, being kids and all that, you know, you like to play ice and fire, all this kind of stuff.
Yeah, police and thieves and whatnot. Yeah.
Exactly. You may sustain an injury without you realizing. So is that the case? Why, when they grow older, towards their teenagehood, that they are having issues like this, and then that's why they have this issue, and we can classify them as being a young adult with this kind of injury?
All right. Okay, most of the time, injuries in childhood, they heal quite well.
Okay.
Right? So most of the time, they don't lead to later injuries unless it's been symptomatic all this while.
Okay.
That means if you had an injury at childhood and you have persistent pain but you ignore it,
that's when it becomes an issue.
Yes.
All right. Okay.
Right.
Yep. Of course, we do want to be fair here. Granted, we do have two men here. Well, three men actually together with Doc. You know, talking about this issue that we have. I do want to, you know, put my hat on and then representing the ladies out there.
Yeah.
Because one of the things that a lot of people actually talk about, especially ladies, is that they have this issue when they wear high heels, and somehow or other bunions appear, or should I say, comes out from their foot. Well, first of all, what is bunion? First of all, I don't know whether I'm saying that right. And is it wearing heels? Would that be the major cause of women having bunions on their feet?
All right. Now, this is a very interesting question. There's no short answer to this, but I'll try to summarize it.
Okay, please do. Our show is not that long.
No. You're wearing heels?
No. I'm talking for Zoe's.
Okay, so when you say bunion, you are actually referring to the angulation of the big toe.
Okay.
All right.
Right? So the big toe deviates inwards.
Okay.
Right? So that's what we call as a bunion. Right? Now, there's no single cause for this, but it is assumed that it could be because of tight shoes.
Okay.
Or some underlying problems like flat foot or ligament laxity and all that things. So we can't really blame all on shoes, but it does play a role.
It does play a role.
Right.
Yeah.
Okay.
Right?
And how bad is bunion actually? I mean, does it restrict your movement? Does it cut your blood circulation? What is it then? Is it just a growth in your feet?
Okay. The actual mechanism is quite complex. I don't want to go into all that.
Sure. Okay.
But the most problem from bunions comes from pain, right? In Western countries where it's cold, where you need to wear boots and whatnot in winter, then it becomes a bigger problem. In Malaysia, it's not so much of an issue because we usually wear open shoes and all that. But most of the time, because you have a deformity in the big toe, there's pressure on it from the shoe, which causes the pain.
Okay.
Right? So if it is very severe, it can cause deviation of the second toe, but the most problem is from pain.
Right.
Okay.
Okay. Right. So we are still going to represent our beloved women out there, right? So what do you have to say, doctor, to them who prefer style over comfort?
Well, I like to see style now and then.
Okay. All right. That's your preference, yes?
Yeah.
Hey, me too.
Me three. Exactly.
But of course, you can imagine that we are not meant to walk on our toes. Right? We are meant to walk on our feet. So if you wear heels and force your foot to walk on the toes, it's not going to be without its problems.
It looks nice on the eyes and me.
Yeah, true.
Yeah, but the pain that they carry.
That's why,
All right.
So,
sorry.
Yeah, so there is going to be issues, right? Because you are going to force all the load to go into the front of the foot. It's going to cram your toes in. It's going to load the forefoot, the ball of the feet more.
Sure.
So it is going to lead to problems.
It is.
So yes,
in the long run.
Yes. So if you want to wear, not to say you cannot wear, but keep it in
You have to do that check and balance, right?
Exactly.
You want to wear? Okay, you wear, but maybe probably not too long or not
Maybe
too
not too
often,
high.
or probably not too high.
Yeah.
Yeah.
Again, I mean, like, you know, we need to talk to our co-anchors about this as well.
Yeah, we
so, shifting gears a bit. Again,
she's a star. She comes on set with the heels, but outside there's her slippers are there.
Yeah, her slippers are always there. Now, let's change gears a bit, because Brandon also touched about the athletes, because again, athletes, how they actually perform, being elite athletes is because they start at a very young age, as early as 5, 6, 7 years old.
Right.
They push themselves to the limit that they actually can. Obviously, in the long run, coming to this problem again, looking at the foot and ankle, it would only deteriorate the condition of each muscles and each ligaments as well in each foot, right? So how would the best care be then for any athletes out there who want to make sure that they are within their parameters but still performing at the highest level?
Okay. Again, you're asking very tough questions here.
That's why you're here.
All right. Now, obviously, there's no simple answer to this.
Okay.
It depends on what sports you're doing. It depends on how strenuous you are with the sports. It also depends on your shoe wear and your other safety gears that you are wearing. And it also depends on who's coaching you.
Okay.
Because if the coach is not good, then obviously it's going to be stressing you too much in the improper way, in not a very proper techniques. So this may affect you, right? Probably you should consult a sports physician who could advise you more on, injuries and how to diagnose these injuries early and, manage them before it becomes a big issue. But I have to say that sometimes if you push yourself too much too soon, later on it's going to catch at you.
Yeah, that's the thing, because I'm sure when we were young as well, all we just wanted to do instead of just studying is play sports, hang out with friends and just exert our own body, because the mind tells you that you can do it, but actually your body is telling you, no, I can't. So that's when we sustain all these kind of injuries, right? But when we get this kind of injuries, doctor, most of us will be scared. We won't want to go and see a doctor, because why? See a doctor, leg injury means surgery. Yeah. So actually, when do we need this surgery? Truth be told.
Right. Okay. I agree with you. There's a most common misconception that people have, and they think that when they come to see a surgeon, that means they need surgery. Right? Actually, it's not the case. We try to exhaust all the non-operative management first before we move on to surgery. Right? Of course, there are some conditions that obviously need surgery. These are obviously things like fractures and whatnot. So these things you can't really manage non-operatively. All right? But most of these injuries to the ankle and foot, especially these common sprains and whatnot, as I said earlier, can be managed non-operatively if you do it properly.
Okay.
Right? Of course, if you're talking about professional athletes who need to return to sports early, then maybe early surgery may be indicated. But most of the time, it's not.
Yeah, we don't have that facility.
Yeah, no, we don't. I mean, like, the most that we do is just like
ice bath.
Yeah,
just dip your feet inside the I don't know, basket or whatsoever.
Not even that. It was just like typical minyak angin, and that was it. Like that's how simple it was.
That's the best kind, right?
That's the best kind, exactly. All right. Again, let's talk about the layman, the other people, because again, we were talking about this off air, how important it is for anyone out there to make sure that they're wearing the proper kind of shoes, the proper kind of cushioning. It also depends on the kind of feet that you may have. Could you elaborate that a bit? Because all we know is shoes that being sold.
Shoes are shoes.
Shoes are nice, and that's
you can just wear it.
So
That's right.
No.
Okay, so if you look at our feet, it looks fairly common, right?
Yep.
But even in your hands, they are not really the same, right? Different people have differences in their hands,
Looking at my
amount
hands.
of movements that you have and all that. This goes to a different level when you go to the foot because it's load-bearing.
Okay.
Right? So when you stand on it, how your shape of the foot behaves or maintains causes pressures in different areas, all right? So some patients may have flat foot, some may have high arch foot, some may have some clawing in the toes and all that thing. So these are all variations in the foot.
All right.
So the best thing is if you have a flat foot, and it's better to have something that has a mild arch in the shoe, which could help support the foot, right? Cushioning is also important. It also depends on what activity you're doing. If you're just simply walking on flat ground, probably it's not so important. But if you're doing vigorous activity, a softer shoe may be helpful. Because if you are landing hard on the floor, then you might develop
another sort of injury.
Yeah, soft tissue injuries to the heel and whatnot.
Yeah.
Right? And too tight, too loose, these are also things that would matter, because if it is too loose, sometimes there is too much motion and can cause blisters. If it's too tight, then it can also cause pressures and problem with the...
So before we head on down to when do we need to see a doctor with regards to our injuries, because you've already elaborated that it's not common to come with an injury and say, okay, you need surgery, but there are cases saying that yes, you do. But let's talk about how we can prep ourselves well before playing that particular sport. If you're an athlete or if you wear heels or whatsoever. We're not talking about warm-up techniques here, but is there anything we can do to better prep your muscle or your ankle or your skeletal system before doing that sports or whatsoever?
So what you must understand is that injuries happens when you are not prepared. So it's more common in weekend warriors rather than actual athletes. Right? So the key here is that don't suddenly go and do something that you are not used to. So train yourself towards it. I think that's the best thing.
That's the best thing to do, just train properly.
Yeah, just train properly and never take things for granted, because again, you might never know literally the next step that you take could actually be a dangerous one. So, talking about and literally as well. Last words from you, Doc, again, because from an old man like Brandon, myself as well, and other younger men out there as well, what is the best way for you to keep healthy because of taking care of your foot and ankle for them not to see you in the operation room?
All right. Okay, so as I said, train yourself, right? Pace yourself, build your stamina slowly, and then go towards competitive levels, all right? If you do have injuries, ice it. Don't force yourself to continue to play unless it's very mild, all right? Elevate the foot and come and see us. Right? So we can assess and see how serious it is. Most of the time, probably non-operative.
Right.
But if you do need some special care, at least we can do it early.
Okay. I'm sorry, I need to ask this one last question.
Okay, quick one,
Doc. Ice pack or hot pack?
Acute injuries, ice.
Acute injuries, ice. Hot pack?
Hot pack is for more chronic things.
More chronic things.
Okay. Yeah, that's it. Luckily, our boss is not firing us right now because you extended the time. Thank you so much to Dr. Kanthan, the consultant orthopedic surgeon from Prince Court Medical Centre, for coming down. Thank you so much, Doc. We'll definitely be wrapping our ankles in ice.
Hopefully not.
And hopefully not. Hopefully not.